you. So mobile devices off, cameras off if you're not speaking, please. And don't use Microsoft Teams. Now, members of the board and officers supporting the meeting. Now, I have here Carol Camis, Ulla Corinne Clark. I haven't seen Philip Cook pop up, but he's meant to be here. Graham Ebers, John Halsall, Leader of the Council, David Hare, myself, Charles Margetts, Debbie Milligan, Matt Pope, Jim Stockley, Katie Summers, and Chris Trail. And officers who are here, Neil Carr, Narinda Bra, Peter Slade, Lewis Willing, Ingrid Slade, Meredin Peachy, Chris Barrett, or Sarah Rayner. So have I missed anyone out?
I think you've missed me out. I think you've missed me out, haven't you, Charles?
My apologies. Who was that speaking?
It's Matt.
Oh, sorry. The camera off. Matt Pope as well, of course. So the meeting will be webcast and will be available to view online to anyone who wishes to at a later date. So first of all, can I ask for apologies for absence?
I've got apologies from Graham Ebers and Susan Parsonage.
Katie Summers from the CCG.
And Sam Burrows and Tessa Linfield, Chairman.
Thank you. Okay, so can I ask, next item is minutes. Can I ask for members' agreement to the minutes dated the 11th of June 2020 and the extraordinary meeting on the 9th of July 2020? If anybody is happy with those meetings, if anybody has any amendments, please say now. Okay. Can I ask next item, declarations of interest? Are there any declarations of interest? Okay, next item, public question time. Are there any members of the public basically with questions?
None received, Chairman.
Thank you. Next item, member question time. Are there any member questions basically? Any members here want to ask questions?
Again, none received, Chairman.
Okay, thank you. So we're on to the Wokingham Wellbeing Board Strategy Progress Report. And my note says, Charles to ask Meredin or Ingrid to introduce the report.
Thanks, Charles. It's Ingrid here. Apologies, I won't put my camera on. I'm having internet difficulties today, so putting the camera on reduces my capacity to speak.
No problem.
There are 3 papers submitted for this item on today's board. So there's one which addresses the action bit of strategy into action. The second paper is a healthy weight briefing in light of COVID, and the third is a progress report. So just as an introduction to this item, as you all know, COVID's clearly had an impact on services and programmes going on throughout the borough. In some cases, this has actually been a positive increase with, for example, an increase in demand around smoking cessation in light of COVID. In other cases, it's merely been around service delivery adaptation, given current guidance. And for other services, they're obviously facing increasing demands, for example, as rates of social isolation and loneliness have increased over the past 6 months. And on top of that, COVID itself has highlighted certain aspects of health that are important to note, which I'll go into in a bit later. So the first paper, the action bit of strategy into action, this is actually my first health and wellbeing board. So for those that met me, Ingrid, the public health Wokingham, and I've been at the Health and Wellbeing Board strategy, obviously, and propose a structure that the public health team will put in place with an aim to provide regular and effective reporting on the progress of this strategy to the Health and Wellbeing Board. So that first paper addresses that structure. So there are 3 action groups proposed, one for each Health and Wellbeing Board priority. Each group will be led or co-led by a senior public health officer with expertise in that area of work. And I think we believe that for effective action, these groups should be co-led by a key service delivery partner. And we've already had agreement from Sports and Leisure, for example, to co-lead the Creating Physically Active Communities group. And these groups should be small and action orientated. So we have a list of potential stakeholders and partners in the paper, but we would suggest a maximum of 5 to 6 partners per group, with a wider network kept informed with communication. So there are clear key partners in each of these groups, so sports and leisure for physically active communities, and obviously the voluntary sector for reducing social isolation and loneliness, and children and young people for narrowing health inequalities. The aim of these groups is to identify and bring together the work that is happening through our services across the locality relevant to each priority, and then with public health input to establish a reporting process that's robust and it captures progress against each of the Health and Wellbeing Board's key priorities. And each group would provide a short report monthly and a more comprehensive quarterly report against the priorities for this board. So on that first paper, which we've brought to the board, I'm proposing the structure to be noted and to ask if any board members can identify any key partners omitted from the proposals, from the key list of key stakeholders and partners. Is that something I can ask now, Charles, or shall I carry on?
Sorry, please. No, go ahead. Ask. I mean, I'm keen to see this gets full support, so please ask the question.
So if there's anyone who has questions or additions to those lists of key stakeholders and partners, please let us know.
I should say, put your hand up if you want to speak. I can see Phil Cook has got his hand up already, so please go ahead, Phil.
Thank you, Chair. Ingrid, just to say, I note on each of the 3, you've got VCS leads, and you're right, voluntary community sector organisations are critical to this. I'm happy to help and support, provide who I think could be some of the key leads that you could have as those members of those subgroups, because I'm keen that it doesn't just end up falling too involved to sit on all of them when there are other organisations more connected to some of those particular areas. So I'm happy to pick that up with you as and when you're ready.
That's great, Phil. Thank you.
David Hare?
Yeah, I just wondered how service users would be involved in this, because obviously they're an important voice, and how will you make sure that their voice is heard?
I think that's a really good point. Thank you. And perhaps that's something I can investigate further. I don't know whether there are organised channels around that. I noted in the minutes from last meeting that there was a move to incorporate qualitative experiential feedback into these as reporting items. So it might be that we can incorporate both of those things together, but I will can take that into consideration. Thank you.
Any other questions, comments, basically? Volunteers for Ingrid? Phil?
Yeah, sorry. Thank you, Chair. I wonder if on the reducing socialisation and loneliness, perhaps. Sorry, I'm getting a bit of feedback.
We can hear you, Phil, so go on.
Thank you, Charles. I wonder if we want to include parts such as town councils, maybe, and organisations such as police and fire service. I do wonder if they maybe contribute to that heading quite nicely.
Thank you.
Okay, I think my view on this, I think this is very good. My concern with all of this, not concern, that's the wrong word, but question when I first saw this was just there's a lot of work here, and for this to be successful, it does need people to engage with it. And I think, Ingrid, if you want me to write to people or some of these groups and try and get them to help, I'm more than happy to do so.
Thank you, that's much appreciated, Chair.
Okay, do you want to go on, Ingrid, on this, or any other questions?
I'm going to move on, if that's all right, into our second paper. Oh, there's a question from Carol, sorry.
Not a question as such, but a comment in relation to reducing social isolation and loneliness. I'd like to see our care leavers feature in that, because they really do struggle with social isolation and loneliness, and it may be that we could get some really articulate young people to be part of the key stakeholder group for that priority. And priority 3, obviously, I'd like to be involved in that one. So where it says children and people's leads, you could put me down for that at this stage, and then we'll kind of develop it as we go in terms of who we think are key people from children's moving forward.
Thank you, Carol. I really appreciate that. We'll continue that conversation when we meet.
Yep, no problem at all. Thanks, Ingrid.
So moving on to the second paper, which is the summary progress report, which is a summary report which we're bringing as an interim measure before these smaller action groups can report back. There's just a few things to highlight really on this document, just to give some understanding of the current situation, I suppose. So in the first key priority area, creating physically active communities, I think everybody's aware that the sports and leisure services had to shut across a prolonged period of time, and that those have reopened in the past month very successfully. But so we will obviously have a gap in reporting and impact across that period of time, which we'll have to accommodate. Interestingly, the sort of converse I wanted to highlight is that the My Journey team have had a very high demand for local cycling initiatives over the past 6 months, and have actually run out of capacity and are running a waiting list. So one of the opportunities we've identified to progress over the coming months is to look at how we might be able to increase that capacity around walking and cycling programmes, specifically with a health base. The other thing that has been noted, and I'll bring that up with the last paper, is that we have noted a gap in our obesity services in Wokingham, which I'll talk about a bit more in relation to COVID with the last paper. With priority 2, we're only really just beginning to understand the impact of the last 6 months on social isolation and loneliness, but as you might imagine, I think it will be large. One of the things that we need to explore that is down in the opportunities to progress is the rise in alcohol-related referrals from the community to community mental health teams. So there's clearly been a rise in alcohol use over the past 6 months, and its impact is yet to be determined, but just highlighting that. And in our last priority, narrowing health inequalities, I just wanted to highlight that RBH maternity services were really quick to respond to COVID-19 and adapting their services for local women, pregnant women, and have continued with their services for our pregnant women. But there is a gap around smoking cessation and in pregnancy that we need to address, and we're well aware of. So the last thing I just want to highlight on this report is that there is an opportunity here, and I'm asking the board to recognise that there is a need to incorporate regular reporting on the inequalities identified through COVID, specifically around BAME communities and obesity that weren't in our measuring outputs. Perhaps if I push on with paper 3, that might become a bit clearer. Are people still able to hear me, or am I on my own in the meeting?
I can hear you.
I can hear you.
Oh, it's just Charles.
I can hear you.
Okay, grand. Should I wait for Charles or shall I carry on?
I don't know. Neil, who's our deputy chair? Is that Debbie?
Yeah, I can do it.
Is, yes.
Charles frozen. Yeah. So yes, go ahead, please.
Oh, well, he's back.
Here he is. Okay.
I'm back. My apologies. I've just done one meeting where my broadband's held out perfectly, and it's gone twice in the last 5 minutes. So I don't quite know where we're up to. So I'm
just about to start paper 3 and explain why that's in there. This paper was brought actually by Meriden, who was keen to share this with the board. So you'll remember during the tail end of the lockdown, the government published a policy paper called Tackling Obesity, which was born out of the new understanding that there was an increased risk associated with COVID with an increase in BMI. So as a result of that, and looking at our own provisions around obesity, we've recognised that there's a gap in what we call Tier 2 weight management provision. So all I guess I'm asking at this point for the board to note is that there is that gap, and that we would look to include obesity and healthy weight as a priority group over the coming months, especially around reporting, but also around action from the public health point of view.
Okay. Any questions, comments on that? Okay. Are we therefore on to ask the board basically if they agree to the recommendations in the report? Board members to only speak if they do not agree. So can I ask anybody, I'll be silent for a moment, anybody who disagrees, please speak, otherwise we can consider that approved. Okay, thank you. So that's great. So can we move on to item number 12 now, designing our neighbourhood, and if Lewis Willing is here, please, to introduce his report.
Yes, Chair. Right. If you're happy, I'm just going to share my screen to be able to see it. Okay, so we're here to talk today about the Working Integrated Partnerships Design Our Neighbourhoods project scheme. So this piece of work has been discussed at the delivery group and the leadership board, and we're going to have a quick chat. So what's the aim of our Design Our Neighbourhoods? So it's the philosophy which is used to underpin all of our project activity in the Working Integrated Partnership. We aim to use information and insight from a broad base of data to have a data-led approach. So this would be our population health management. We're going to seek input from the community as well as the professionals about what we plan to do, with which cohorts we plan to work with in the community, and what we plan to do and how we plan to do it. We will seek feedback from the community as well as from the professionals for those interventions too. And we plan to create a one-team ethos for our work with all of our partners. So it doesn't matter what uniform you wear, it doesn't matter what badge you carry, we all support the people of Wokingham as best as we can. So how do we suggest that we carry out that aim? So we have a three-stage approach. So at the moment, we are entering stage 1, which is to scope out all of our projects in our programme and include, where possible, PHM, so a population health management approach. So this is looking at data that we hold in the council with our partners in the voluntary sector, with health partners and things such as the IPA tool to understand what the data tells us about different areas of the community and why we may potentially wish to work with them. Feedback from all of our partner agencies, so that's our other folks which are in the partnership, as you can see below in the little footer there. Feedback from our partners, the target of the project as well, whether we're going to work at a neighbourhood level, which would be our primary care networks, whether we're going to aim to work as a borough, or whether we would be looking for the Bob approach, west of Berkshire or the whole of Bob. For the projects that we're going to be running as a part of our thing, it's going to be neighbourhood level or borough level. But obviously going forwards and having not completed the scoping of the projects, that potentially there will be some overlap there. So for stage 2, we plan to hold another Design Our Neighbourhoods workshop and run through each of our projects and explain what it is that we're going to do, explain how it links to the 5-year forward view, how it links to our wellbeing board priorities, which we have here for our 3, how it links to any ICP or DESs or KESs for those folk which are a part of CCG land, so that will sort of have to do. So what will the project be doing? And we'll check with the people that are present. Are the right people involved in that project? Are we targeting the work correctly? And are we looking at the right area of operation? From that feedback, we'll use that to update our plans wherever possible. And then after that, we plan to go on a tour of the parish and town councils to explain the projects that are going to be going on in their neighbourhoods and the focus of those projects to make sure that everyone's involved. So now we've sort of explained how it is that we plan to do it, who are we going to involve. So essentially everyone that took part in the last Design Our Neighbourhoods event, it was very successful. It took place in February, and sadly we couldn't prioritise or jump on all the goodwill from that event, as we've had unfortunately had the COVID crisis. but we plan to have a very similar group of people, with the addition of any parish councillors or service user experience groups, which may not have been able to make it previously. An example is below. So the voluntary sector providers that we currently work with, the borough councillors, social workers and commissioners from the council, CCG representatives and commissioners too, our PCN directors, or at least representation from those groups, colleagues from Berkshire Health Foundation Trust, from Health Watch, any patient experience groups which may wish to join us, and town and parish councillors. Obviously, this list isn't exhaustive, but it gives you a flavour of the type of people that we would wish to be involved with our projects. So the things that we haven't yet fully considered and slightly unanswered, we do plan to have a session to last around 2 hours, possibly 2.5. Participants are going to struggle if you're having over 2.5 hours, especially virtually, and we will be limited by our ability to be able to have technological discussions in breakout groups. So that's going to be tough. The timing, we need to get this done as quickly as we possibly can, ideally at the end of October, but potentially the beginning of November now, so that we're able to have the maximum amount of time to carry out implementation for our projects. We do have an ambitious programme, which I'll be outlining later, with 16 projects. So we want to have the maximum amount of time to do it. And obviously, this is now no longer, I think, going to be applicable at all, given the information that we were given yesterday, but location. So I do think this is probably going to be virtual, as I don't think we're going to be able to have more than 6 folk in a room. So that one has kind of taken care of itself. So there's my whistle stop tour there. Has anyone got any questions?
Okay, any questions? Last chance. Okay, looks like no questions, Lewis. So can I ask the board if they agree to the recommendations in the report? Please only speak if you do not agree. Well, Lewis, that was obviously so clear. You've got complete agreement. So thank you.
Thank you, Chair.
Okay, now we'll move on then to item 14, which is the joint health and wellbeing strategy for Berkshire West. And Chris Barrett or Sarah Rayner. I think it was Sarah who was here. No, Chris, sorry, my apologies. No, it is Sarah. Okay, go ahead. Sarah, you're muted at the moment.
Sorry.
Okay.
So it's one. Thanks for having us today. So myself and Chris are both here. I'm just going to try and share my our presentation. Hopefully people can see that. Please do shout if not. So to introduce myself, my name's Sarah Rayford. I'm a public health registrar. Currently sit at West Berkshire Council, but I am leading on the joint health and wellbeing strategy for Berkshire West, along with Chris as well. So this was put in place, I think it was decided back in April of 2019 to develop a new strategy that would sit across the 3 local authorities. We've been developing that over the last few months, and this is end of sort of phase 1, an update on our progress for everybody. So just as an overview, the programme plan is as outlined here. So it's been divided into 4 phases, started in March. Initially started with defining the current state, then we've been working through a prioritisation process, will then lead into a public engagement, and then the final production of the strategy itself. And the timeline can be seen on the right as well. So in terms of our progress so far, we started by evaluating each of the existing joint health and wellbeing strategies for the 3 local authority areas. That included mapping exercise of the existing strategies and the priorities within them. We did a desktop review of the data to look at the impact that those strategies have had. We went to local authority public health teams and wider teams to obtain any further local data and intelligence, and we reviewed the delivery reports to the boards. By all of that work and then further sort of engagement with professionals and stakeholders helped us to identify a list of potential future priorities. We've engaged with voluntary groups and with the Acute Trust and CCG, and we've done some early public engagement as well, particularly focusing on hard-to-reach communities. We did an extensive piece of data review to identify what's missing. So looking at areas of population need in Berkshire West that may not have been identified through the mapping exercise. All of that work gave us a long list of potential priorities, and then we've been working through them as part of a prioritisation process. We had 2 workshops in August and a further 2 are planned for September. The first one I think is next week. So just as an example of the work we did looking at the existing strategy for Wokingham, so down the left-hand side, you can see the strategy priority for 2018 to 2021 and specific aims. We then looked at fingertips data, PHE fingertips from 2017 were available, and then more recent data to see if there'd been a difference, and then further populated this table with local data and intelligence. What we did find is that where something was green, it tended to stay green, occasionally change, and things were amber, they tended to stay amber. I think a lot of that's reflected in the fact that it's relatively short term. And that's just the second half of that table as well. This is just an example of the what's missing data review that we did as well. So essentially this was looking at public health outcomes for each of the 3 local authority areas. An indicator and therefore possible priority was included on the eventual list if it was either red in one area or if it was amber for all 3 areas, and that was the criteria that we used. That gave us a long list of sort of 35 potential priorities, and then we worked through the initial prioritisation process, and this is our sort of current state, has changed slightly. You'll see there's a wide range of kind of potential focus areas that will be included on the final strategy. And then we have another sort of set of hurdles that we'll go through with these priorities to eventually determine what the end outcome will be. So as you can see, we've got mental health and wellbeing for children and young people, tackling childhood obesity, falls prevention, community resilience, social isolation, all kind of examples of that. In terms of where we're at now, we obviously have that list of more priorities that will be included eventually. We are currently working through a process of looking at where these kind of interdependencies that exist between these priorities and ways in which we can tackle more than one area by working more upstream. And we are doing a bit sort of further development of the particular areas and mapping out specific areas, particularly something like around supporting vulnerable groups and health inequalities, which are quite broad areas themselves. A couple of underlying threads or themes that have been identified through the workshops that we've done are there. So particularly the idea around promoting empowerment and self-care, digital enablement, there's been issues around the capacity within the system to engage with the process. Obviously, with coronavirus happening just as we were getting off the ground, that's meant that people's time has been taken up elsewhere. And we've also found that with lots of new people in roles across the 3 local authorities, we maybe haven't been able to evidence the impact of the strategy in a way that we would have been able to otherwise. Coronavirus has obviously had a massive impact on developing this strategy. It's been challenging to engage with stakeholders at times, particularly in virtual and having to sort of duplicate that engagement across 3 areas rather than being able to bring everybody together in one place. Public engagement, when we set out, the plan was to have the strategy really led and developed by the public engagement, and that to be the forefront of it all. And that's been extremely challenging in the current environment. And as noted there, we've been unable to do what we'd originally planned. However, we have done some engagement, and now we're working with colleagues across the voluntary sector and with Health Watch and engagement colleagues to co-produce a wider piece of engagement for further along the prioritisation process. Oh, there we go. So in terms of the public engagement, this is what it's looked like so far. So we've tried to raise public awareness that the strategy development is happening. We're in the process of developing public-facing web page through the voluntary sector. There is some information on the CCG page already. We earlier on, as part of the development of the list of priorities, we tried to engage with hard-to-reach communities and vulnerable groups to help us develop this original long list, and that was done in the end through a online survey using community engagement champions and different community networks in place across the 3 local authorities, and I'll share some results shortly. And then in October and November, our plan is that we will reduce this list of priorities down a bit further, and then we're going to take the final list of around 10 or so to the public with a wide-ranging piece of public engagement to actually then finally refine those down into what will be the end priority. So really using that public engagement piece to help us do that final prioritisation. So in terms of the online survey, so we had about 3 different questions. We had a number of priorities that we asked people to rate as how important they were to them. Was it something very important, important or not important at all? And then in terms of the most areas that were most likely to be rated as extremely important were the following. So good access to healthcare services. 96% of respondents felt that was extremely important to them. Improving mental health and wellbeing of adults, but also children and young people. Improving education development of children from poorer backgrounds. And then having good employment options for everybody and feeling safe. They were the top few that people felt were extremely important to them. We then asked people to to give us 3 things that were important to either themselves or important to their community. So it was free text box. And this is how this came out. Apologies for the watermark behind this. We are going to be producing one without a watermark. This was done quickly as an interim result. But this is just showing which, obviously, the larger the text, then the more often the words were expressed. And so in particular, access to services and mental health were particular areas that came out very strongly through this public engagement. And this again is the free text, sort of the theme down the left-hand side, and how often they were mentioned by either the respondent's own health and wellbeing or that of their community and health wellbeing. So as I've mentioned, access to medical services was the most commonly suggested area, open space, mental health and community engagement, and then as we see going further down the list. And then just as an example of some of those themes and what people were saying, so for example, access was access in its very broadest sense, so something around referral rates, referral times rather, but also around communication through when seeing a health professional, physically being able to get to a health service. Open space was around cycling, came up very often, swimming, physical open spaces that were available. And healthy environment included, air pollution, improved public transport, for example. So our next steps are, so those are just interim results of the online survey. That has now closed just recently. So we'll be undertaking a final analysis of that online survey. We will be continuing to develop the potential priorities. We have stage 3 of the prioritisation process happening next week and the week after. We have online virtual workshops that are split into 2 sessions, 2 hours each. And that's the next focus is going to be around aligning with the rest of the system and fitting along with COVID recovery. And then, as I've mentioned, we're co-producing an engagement plan with stakeholders. When we've got our final, our shortlist of around 10 to 12, we'll take those out to the population, doing a public engagement piece over about 2-month period to help to refine down into the final priorities. And then the draft strategy is going to be started to be created alongside this work as well. And that is the end of the presentation. I shall stop sharing. And I'm happy to take any questions. Oh, I can't hear you, Charles.
There we are. I had a couple of questions on this, which were basically, I accept that obviously the public consultation's obviously been difficult due to the situation, but if I had a concern about all of this, I can see a lot of work's gone into this as well. If I had a concern about all of this at the start, is how much this would actually reflect the very different areas of Wokingham, West Berks and Reading. So my questions were related to that. Your online survey, first of all, how many people did you get responding? And are the results split by borough? And what do you mean by a wide-ranging public survey? You said it would be 2 months. How many people are you aiming to target, and how, basically? And what kind of, are we going to get, are you trying to produce one universal strategy, or is it going to be tailored and different to reflect the different characteristics of the 3 boroughs?
Yeah, they're absolutely very, very fair questions, and I hope I'll address all of them. But if I forget one of them, please do remind me. So in terms of the strategy overall, so the ambition is to create something that's across the 3 areas, sort of acknowledging that there's different sort of stakeholders that work across that patch, and really trying to target things that there's value added by working across that a bigger area. However, that being said, as you rightly say, they are 3 very different boroughs and areas and different levels of population need, and that's already been identified. And I think there is, as we develop the strategy, there will be some sort of an individual kind of focus for each of the 3 areas. So although it's one overarching strategy, we already know that there'll be kind of different, it'll have a slight flair for each area, if that makes sense. So we will be reflecting the individual picture, and because that issue has been raised throughout the process. In terms of the public engagement, so the original survey, we had about 130 responses, although there's also been some work done by public engagement champions, and that was because that was done with hard to reach communities. Those have been on paper copies, and we don't have those results yet, but I do accept it's a very small proportion of the Berkshire West population. There's no hiding that. So that was really just to give us a bit of a kind of temperature check, I suppose, to say, well, actually, we've got this long list. Where is that kind of looking in terms of priorities? The 2-month engagement that we're doing, we're working with, so we've got a task and finish group set up. So that includes Health Watch, voluntary groups, engagement champions for each of the 3 local authorities, CCG representatives, and the engagement lead for the ICP as well. It's going to be wider than just an online survey. We probably will use an online survey as a part of it, but we're planning focus groups within existing groups and community groups, support networks. Hopefully we'll set up some levels of focus groups that are just brand new and inviting people. We're going to have a landing page that invites people to comment if they just have things that they want to express as well. So it's all kind of still in the planning phase. We're on a short timescale and tight deadlines, but we're going to have it as wide-ranging as we can. I haven't got numbers for what we would hope to achieve, but we are hoping to get many responses and to really push it out there as far as we can. And we're really, looking for support with that if anybody's able to give us any of that as well, because it has been incredibly challenging, the public engagement side of this. I think that was all of your points, but if I've forgotten one, please do.
No, you covered them all. I mean, I think all I would say is, for this to be meaningful and actually valid to people, we've obviously got to get a lot more than 130 responses. Because no matter how well thought out and basically how well intentioned it is, it's on behalf of the public, so it should represent their wishes. And I can't speak for other people. I mean, I know we in Wokingham would be happy to publicise it and actually circulate this, but we've got to do this because 130 people there are more people who live on my road than that, basically. So and I don't mean that disrespectfully in any way, basically.
No, I completely take that point, and I agree with it as well. And we are doing absolutely everything we can to, we're really passionate that we get, reach as many of the population that we can do. I think there's a couple of hands, so I don't know if...
So who have I got? Chris Barrett, question, please.
I'm sorry, Charles, if my hand's up. I don't mean to be. I'm here with Sarah to support her. So apologies for that. I'll take that down.
Thank you. No worries. Phil?
Yeah, thank you, Chair. So just quickly, Sarah, of the 130, do you know where those 130 are from? As in, is it 130 Reading residents?
Yeah, we have. Yes, we did ask that question. So we did ask ethnicity, where they're from, age as well. Sorry, I can't remember off the top of my head. So there was a spread. I think there was a greater proportion from Reading, I think, but then there was, I think, probably about 20% from Wokingham. The biggest number of people were from Reading, and then Wokingham, and then West Berks was the least well represented. But we had about just under 60% were white, and the rest were non-white. So we were really trying to focus on kind of harder to reach groups. But we can analyse the results by area as well, because we've asked that question.
Thank you.
Debbie?
Yeah, I just want to support Charles, really. You know, we just need to get those bigger numbers. To be honest, if I were you, I wouldn't analyse the 130 where they came from, because I think it's meaningless. I think we just need to use all our different comms teams and avenues as much as possible to get the word out there, to ensure that we are kind of aligned with, you know, what we're expecting. I suppose the only thing on the short responses that you got back is, I'm sure if we had done the same survey even a year ago, we would have got different responses. You know, I think car parking bins and libraries would have featured higher than open spaces and exercise. But I think that's because, you know, I think people really valued our spaces that we had, particularly in Wokingham, during the COVID crisis.
Yeah, I think that's very true, definitely. Thank you.
Any other questions? Any other comments? No, that's silence. So can I ask the board if they agree to the recommendations in the report? Board members only to speak if they do not agree. Okay, I mean, thank you. Well, that's agreement. I think I'd just implore you to use all the people in this group to help publicise this as much as possible, because it's for everybody's benefit. And, you know, we can't really write a strategy off tiny numbers of people. But yeah, it has my full support. I don't mean that negatively in any way, because I can see there's a lot of work.
Thank you. Thank you
so much. Right, on to item 16, which is integration update. And could I ask Lewis to present this, please?
Yes, sir. So, a brief overview of how we're getting on with our integration work at the moment. As we all return to business as usual, the Wokingham Integrated Partnership Leader Group has agreed the programme of work for 2021. This programme aligns with the strategy for the Wokingham Wellbeing Board, as well as the NHS long-term plan. It takes account of best practice and has been shaped and subsequently agreed by all of the partners as a way forward post-COVID. So, the programme plan is set out to 5 key priorities and has a total of 16 projects, and it breaks down as 3 for our work with supporting our primary care network development, 8 to support our integrated care network development, putting together of community health, adult social care, voluntary care sector services into a single model which wraps around our PCNs. We have 3 which fall within our creating healthy communities, designing our neighbourhoods piece of work, and 1 each for the implementation of population health management across the borough, and our ongoing requirement to support our Better Care Fund targets and manage the Better Care Fund programme in general. 16 projects is ambitious. We are planning where possible to deliver in year, but we do need to be mindful of the fact that that's a healthy slab of work, given the fact that we are, as they sort of say, coming out of COVID. There's risks associated with that in terms of delivering within the year. Timelines and resourcing of each of these projects is currently being developed as a part of our scoping process. We are writing PIDs for all 16 of those at the moment, and apologies to all the folk that are having to spend so much time with me in those meetings. I think some of the good news stories that come out of this piece of work is that there's eight project managers with 3 parts of the council representative, along with clinical commissioning group, our colleagues from Berkshire Health Foundation Trust as well. Senior responsible officers come from 5 partner organisations with primary care network clinical directors aligned to each of the projects. This reflects the established nature and the maturity of the Wokingham Integrated Partnership and the understanding of the group that this work will lead to an improvement in the experience of the people of Wokingham, which I think is really good news. Strategically, as shown in the table above, in the report, the programme aligns with several elements of the NHS long-term plan and the Wokingham Wellbeing Board. It also aligns where possible with the West of the Bob integrated care system priorities, which are around preventing ill health, shifting focus from treatment to prevention, and adopting population health management approach, which, as I've spoken twice now about, is key to the work that we're doing. Collaborating across acute trusts and with partners to improve efficiency and optimise available capacity across the system, and to increase our ability to support people in their own homes and avoid an urgent and emergency visit. As sort of previously described, the next step is scoping out of our projects and moving on to project implementation, should our colleagues be happy with that at our Better Design Our Neighbourhoods event. So yes, that's kind of where we see ourselves. Hopefully we should be starting delivery of our programme at the beginning of November.
Thank you, Lewis. Any questions, any comments from anyone? No, that all looks good. Okay, can I ask the board basically if they agree to the recommendations with the report, and only to speak if they disagree? Okay, so that's agreement on that as well. Okay, so the next item is the forward programme, which is in the agenda on page 80. Does anybody have anything they would like to add to the forward programme or to change? Okay, then I'd ask basically the board to note the forward programme and only to speak if they do not agree. And then final thing was any other business, and the question that I was going to ask, which was raised I think at the last one of these, was regarding flu jabs, a general question, but I think the message at the time was that they've been prioritised to over 70-year-olds, over 65-year-olds, but 50 to 65-year-olds should be getting them imminently. I think it was Ulrika and Clark asked me basically, or had received reports of a surgery in her ward where the surgery was telling people flu jabs were not available. And I was just wondering if anybody from the NHS or could give us any kind of feedback on that.
Yeah, I'm the only one for the NHS. So yes, the flu jabs are being delivered. Each practice is working slightly differently. I think Ulla Corinne said earlier that she's actually got a dedicated line at her practice. I can't take responsibility for that. That's obviously the practice that is organising that. So patients will be informed when the flu jabs will be done. It isn't just a rock up and on a specific Saturday or an afternoon to have your jab done. You will be invited to have those immunisations done. We haven't been informed so far that there is a problem with supply, so we're getting to people as quickly as possible. We also have the availability of going to pharmacies as well. So yeah, anybody and everybody that can do flu jabs will be starting them. I think some practices are doing them possibly this weekend or the following weekend, so it's happening.
Thank you. Ulrika and Clark?
Okay, thank you. So my question then, somebody contacted me who is a patient at Brookside Surgery, and they tried to get the flu jab because they're over 50. They received a letter saying, we haven't got them. If we get them, you may have them. And they queried that with me. And of course, I thought it was a very strange answer. Either they are going to be provided with the flu jab or they are not. And is this something which is just happening in that surgery, or should we tell the couple to go somewhere else?
Can I answer that?
Please, David.
Because my wife's a GP, so I know something about this. Certainly, 50 to 64s are at the bottom of the list unless they have another qualifying reason why they need the flu jab, because obviously they're the youngest and least vulnerable, and therefore the 50 to 64s will be the last people to have the jab. Surgeries are getting the jab in different phases, so some already have it. I know my wife's surgery doesn't get.
I can't hear you.
My wife's. Can you hear me?
Hello.
Hello.
Hello, Corinne. Can you hear us?
Can you hear us?
Is it only me who can't hear?
Yeah, I think so, Ola Corinne. Can you hear me?
Hello.
David, I can hear you, basically.
Will I keep going?
I can't hear you.
Yeah,
Yes.
Please keep going. I might have to drop Ola Corinne an email after this.
Okay, thank you. So their surgery doesn't get the injection until the end of September, and they have been told that if they give any 50 to 64s who haven't got any other qualifying criteria the jab before November, they will get fine.
I can't hear the answer, but we were told last time we had this meeting that it was going to be available to those over 50, and that is what I wanted clarification on.
It will be available. Can you hear me now? It will be available, but not until after November, unless they have another reason for injection.
I can't hear anyone. Hello.
Ola Corinne, can you hear us now?
Sorry, you're saying my name, but that's all I can hear.
Okay, I'll email you an update later. Can you hear us now? No. Okay. David, perhaps we need to, and Debbie, perhaps we need to take this discussion offline, if you don't mind, just when we can get to the bottom of this, when technology is a bit more friendly.
I'm being logged out here.
No. So I will say, basically, is there any other business for anyone else? No? Okay. Well, then I will say thank you very much, and thank you for your time. Thank you for your time tonight, and we will pick this up next time.
Thanks, Charles.
Thank you.
Thank you. Thank you, Charles. Good night.